First of all, welcome and thank you for taking time out of your afternoon to speak with us today. We are going to be talking about the ABMS portfolio program, and this particular presentation is called a sponsor-focused introduction. Next slide, please. So here's the agenda for this afternoon. We'll do some brief intros just following this slide. And then we're going to kind of talk through the life of a sponsor, from initial experience to what they do on a daily basis, to what kind of support do they have and what impact are they seeing. And then we'll have time at the end for questions. Of course, we will have the chat open. So if you would like to pose questions in the chat throughout the presentation, you're more than welcome to do so. Next slide, please. All right, so a few goals for this session this afternoon. Learn about the portfolio program and its purpose, hearing from different from a couple of portfolio program sponsors rather, and then understanding what the application process might have been like and what it's like to manage a portfolio program. Next slide, please. Before I hand this over to Ronnie, I just want to stop and pause and let you know my name is Tina Nelson. I am with the ABMS portfolio program, as is my colleague Spencer Walter, who is running the slides for us today. And we just want to show our faces so you guys know exactly who you are, or who you're talking to rather. And then Ronnie, if you wouldn't mind, if you could start by introducing yourself and telling a little bit about your role.
Sure. Hi, good afternoon, everyone. Thank you for joining us, and I'm happy, and thank you, Tina and Spencer, for inviting me to speak. I am a general pediatrician by training, and I serve as the Executive Director of Medical Education and the DIO, the Designated Institutional Official at Nicholas Children's Hospital in Miami. And pretty much in my role, I oversee graduate medical education, undergraduate, continuing education, and obviously faculty development, which kind of the portfolio falls under that because it's part of helping faculty and fellows and residents with their professional development.
Sure. Great. Thank you so much. Rose?
Hi, everybody. My name is Rose Dazalets. I'm a senior program manager at Continuing Professional Development at Mass General Brigham. We're a large healthcare system located in the Boston, Massachusetts area with many academic medical centers, community hospitals, and specialty hospitals and provider networks. So it's nice to, we're an accredited provider, and my office is an accreditation office, and we also are a portfolio program sponsor.
Great, thank you, Rose. Next slide, please. So before we dive in, I just want to take a couple of minutes to level the playing field about the portfolio program, make sure we're all kind of starting at the same place. So the portfolio program was initially set up really to help organizations engage providers in quality improvement work by allowing them to offer, at the time, MOC Part 4, now called IHHC credit, for meaningfully participating in those activities. So that's why the program was started. It has created collaboration across the member boards within the ABMS community, as well as the NCCPA. And all of the boards and all of the boards and the NCCPA who are participating in the program all agree on the same set of standards. So each quality improvement activity has to have meet the same standards, and meaningful participation is the same across the board. Next slide, please. Okay, so how does the portfolio program work? Well, physicians and PAs are doing the improvement work in their daily jobs, and we know they're engaging in that work. And the portfolio program sponsors at their organizations are knowing that they're participating in that work. They gather the information, they pass it along to us at the ABMS where it's reviewed, and from there it is sent on to either the ABMS member boards or the NCCPA, who then award credit to the physician and the physician's assistants within their physician portal. Next slide, please. Oh, sorry. I think we can actually take the slides down now, Spencer. All right, so that is what is the portfolio program. And now we'll go ahead and dive in, starting with you, Ronnie. We're going to talk about the initial experience as a portfolio program sponsor. So can you just tell us how long, I think you mentioned it, but can you tell us how long you have been a portfolio program sponsor and why you joined?
Sure, absolutely. So we've been portfolio sponsors since March 2017, so it's almost 9 years now, a little over 9 years. And at that time, why we joined, I think when initially it was around the time when MOC for maintenance of certification, the different parts came about, and we were trying to see how we can assist our faculty in order to, being in the medical education department. So I always used to get a lot of faculty coming to me asking about if they're renewing their, a board certification or something if they have questions. So I looked into it, and initially being a children's hospital, I started out with American Board of Pediatrics, but then we quickly realized since we have even though as a freestanding children's hospital, we have fellowships that don't fall under the ABP, they fall under the ABMS, like allergy, immunology, urology, surgery, all of the other radiology. So we realized it's an added value for the faculty who are mentoring residents and fellows in their QI projects to actually be able to get another kind of another hook for us or something to give them back, so that they can use that the MOC4, so they feel like there is an added value for them, and not just because they're mentoring their residents and fellows, but also them and their trainees could get MOC points. So at that time, we quickly realized that actually we probably need to be multi-specialty portfolio and go through the ABMS. And I don't think there was a lot of time between the time that I submitted the ABP application to the ABMS application. I think they were very similar, and that was kind of
Sure.
also easy because I had just submitted this stuff for the ABP, so it was very seamless actually. Um, yeah, so
Gotcha.
it's been great.
That is great. And I like hearing the word seamless because we're always aiming for that. So thank you for saying that. And Rose, I know you weren't there at the very onset, but do you have a sense of why your organization joined the portfolio program and how long it's been a sponsor?
Yeah, I believe it was in the early, like shortly after 2010 or 2011 that they joined. And I think it was originated in the quality office and it was being run through them. And then our office, the accreditation office, was a partner in helping facilitate the credit. And then a year or two before I joined this office in 2019, they transferred the ownership, let's say, of the portfolio program or who was running it from the quality office to the CME office, which we are. So that's the history of it. And I think it was really to be able to provide credit for the QI work that was being done in the system.
Sure.
So
Great. Thank you.
sure.
Ronnie, back to you.
Yeah.
Can you describe your experience with filling out and completing the application and just kind of what that process was like? I know it was 9 years ago, so it might not be, you don't know all the details, but whatever you can remember would be great.
No, absolutely. And that, Rose's comment reminded me the fact that I remember initially hearing about the portfolio. And in my mind, in my mind, I thought, and I want to bring it up because I don't want people who are on the call to feel like this is the quality department's role or this is the medical education role. Initially, in my mind, it was actually thinking like, I don't want to step on their toes. This is the quality. So I brought it up to the quality department to like, oh, we maybe need to like somebody needs to apply for this on behalf of the hospital. And at that time, they were very short-staffed and they did not have a physician lead. So but nothing happened. So we probably looked into it before 2017. And then as I knew more about it and I talked to different places that had the portfolio, kind of it encouraged me to actually feel like, okay, even if I do it from medical education, I'm not going to be offending anybody from other departments to feel like
Sure.
I'm stepping on their territory. Nobody cared. Actually, they were happy that actually took it on. So that's now filling out the application was very easy because it's actually submitting some of the work that's already being done already in the institution. So it's actually was, if I remember correctly, there was just you submit a sample of projects that have been in existence. And it was very, very easy and very seamless because that stuff is already there. It's being probably data has been collected for other reasons by the quality department. For if I remember correctly, there was maybe one of our initial examples, that sample that we submitted was I think it was one project related to family-centered rounds, which was already being done, and it was one of the hospital initiatives that the quality department was kind of collecting data on. I think the second one was asthma, related to sending patients out of the emergency department when they come for asthma with an action plan, and that those really, so the data was there. It's just more packaging it and getting it from the departments who are collecting the data, and obviously it needed for us to partner with the quality department, which we've already been partnering with them as medical education, and then putting them into the application. The application is very easy. It's very intuitive, and it's very there are some, if I recall, some questions, but there are also some you can upload some outcome data or form, or like a slide that has the charts or something like that to show an improvement. And then there are a couple of questions related to information about the institution itself,
Hmm.
and that was it. It was very, very simple. And I also some of the data I also partnered with the medical staff office, because they might have some data on like the number of specialties we have, the number of subspecialists in different areas. But those, again, everything, all the stuff was available here, it just not needed to be put together.
That's great. Thank you for that. Um, Rose, I'll come to you and ask, do you have a sense at this point of why your organization decides to continue to participate in the portfolio program?
Yeah, I think it's really so that we can continue to easily provide the MOC, I'm going to call it MOC, sorry, the credit for the work that's being done in quality improvement. And also, the physicians and PAs who receive the credit are always very appreciative that they're being recognized for the QI work. So that's a real big benefit. And also, it's helped us to, like maintain and strengthen the connection with the QI work. And also, it helps sometimes to when people come to us with a project, and it might, because we're the education office, it might not necessarily be something that is we can automatically say like, oh yes, we can provide the IHHC credit for this. But then there's the kind of meaningful participation check marks that you can say, but if you start showing this data in regular meetings, or like it's good to have that as a framework to be able to show people, to show them how they can align it with the requirements and then get the credit. And then, because usually, some groups are already doing it exactly right, but other ones you can like nudge them toward adding the quality aspect onto something they're already doing. And it's a nice benefit because then they're looking at the data, and then it's also a nice benefit because you can give the credit. So it works. So I think those are the reasons.
Gotcha. Sounds good to me.
Mhm.
Okay, Ronnie,
Oh,
why does your organization stay with the portfolio program? I know you answered this a little
mhm.
bit in your previous response, but
Yeah, absolutely. No, there's a couple of really I'll add to what Rose said, mentioned related to added value. I think for the institution, there is one thing, for example, a lot of hospitals in general, I'm going to talk from the administration standpoint. U.S. News and World Report ranking for administration is actually important. And actually, there is a question on the U.S. News World Report survey for the institution. It asks whether you're a portfolio sponsor or not, and that actually provide the institution with added points. So I think if you are thinking about starting it and you're getting a little bit pushback or maybe question about what is in it for us as an institution, that would be definitely important. I think the second thing for us is being in medical education. So I actually bridge both graduate medical education and the faculty. And since trainees can actually bank especially from the American Board of Pediatrics, which is the bulk of our trainees, they can bank MOC Part 4 points during their training. And then when they become board certified, they just have MOC 4 QI points sitting there waiting for them. So being able to give both the trainees and the faculty who are supervising them, those points is very helpful, and it's an incentive as well, and it's an added value. The third thing that I think also was alluded to a little bit for us, we saw at the beginning when we started 2017 with the portfolio. At that time, the whole kind of almost like the past five years before that, um, most people were, QI was something new as far as needing for physicians needing to maintain certification to do QI. So it's almost like when something new, we needed to do more education. We needed to do more education both on how can I achieve to get my points, also how can I start my QI. So we used to do a lot of training for faculty on basics of QI, how to make a high quality improvement project. So initially, at the beginning, we formed a subcommittee that looked at all the applications that were submitted for the portfolio, like an interdisciplinary review committee, to kind of vet the application before approving it for credit and sending it to the board. And quickly over the years, it's kind of very interesting because in the beginning, maybe the first 2 years, we did a lot of back and forth changes, and we advised them. Now, this quality improvement project need to be streamlined a little bit more. What do you think about your outcomes? We made actually a lot of people felt like they actually got a little bit of better projects by discussing them with us. But then over time now, actually our interdisciplinary review committee now rarely meets. It's more really when I look at something and say, whoa, this, I'm not sure. So it's almost like an ad hoc committee that gets together. I think because more of our trainees are proficient in it and more of our faculty are more proficient in QI now, that actually when they submit a project is probably has all the elements that need it.
We found that too, like from when I started in this position to now, like it's much more streamlined with the proposals we get. It may be the way that we're asking it too, but something has like gelled for maybe most involved, right? That it's yeah, we saw that also.
Yeah, and we have
That's
some
great.
junior faculty who, were residents and fellows during the QI era. So they had to do QI during their residency and fellowship. So by the time they became faculty now, it's natural. They're doing it.
Uh, oh, that's great. Okay, well, we're going to switch gears just a little bit and go from talking about kind of the initial experience and what that was like for you guys and why you're part of the program, and really shift to talking about kind of program operations, if you will. So, Rose, this one I'll start with you on. Do you generate activities, locate activities, or a combination of the two?
I would say we locate them. We generally partner with either it used to be called the head of a quality department name. Now it's the office of the chief medical officer, which is in charge of the quality. So we'll partner with them, or we'll partner with departments on the projects that they want to do. And then we'll have them submit we have a proposal process, maybe similar to Ronnie's, and where we review it and we, ask questions about what are you planning, things like that, where are you going to get the data, and we'll help walk through those details. But the ideas for the QI come from the departments and from the quality office.
Okay, got it. Ronnie, what about you? Same question.
Yeah, for the most part, we locate activities. We are probably more of a sometimes I have to remind people when they were talking to me about something, and I say, "Hey, you should get points for that. You should get mileage out of it. You're already doing it." So sometimes I just encourage them to submit for MOC points. Also, very few. We generated a couple of activities that were related to QI, related to medical education. So within the department, occasionally, like we've done a couple of activities that were primarily related to medical education, which the work is already being done anyway, and that has morphed into an MOC generating QI project as well.
Mhm.
But for the most part, it is locating activities.
Okay, got it. And now continue on with you, Ronnie. How would you describe the ongoing administrative work that you are required to do as a sponsor? What is that like for you on a daily basis?
That's a great question. So I'm actually, I manage the portfolio myself. I know some places, um, one thing that makes it easy is the volume of um, projects is variable, but it's not onerous, and really putting it together and submitting it the for approval is actually very streamlined and easy. So I actually manage it myself because we don't I know some portfolios offer also, let's say if it's a hospital and they have 600 um, um, physicians who have privileges, they offer it also as an added value by having a whole team going out to the practices and helping them. And we only do it internally, so that makes it very manageable for me. I think what was helpful for people maybe to streamline it up front is I learned a lot from other people who went before me into the portfolio space, and I used their experience. Our application our process mirrors exactly what I need to submit to you guys in ABMS. And so that makes it easy. I'm the only person, and I'm the one who, once it's approved, I submit that attestation, and so it's very, I would say it's very easy. Maybe the setup initially took a little time to set up and create that process, but I learned a lot from people who were able to share with me and I'm always happy to share my application and my process with people who are planning to apply, because that made it easy to kind of um, once it's set up, it just moves on its own pretty much.
Thank you for that. And what about you, Rose? Is yours similar or do you have a different experience?
Sure. Yes, I also find the ongoing work to maintain the sponsor status to be very simple. We meet with the ABMS, I think it's once a year, to talk about our program, like things that are challenging, things that we want to improve. Just kind of like it's like an interview with Tina or Spencer. And then as far as and then we pay an annual fee. But other than that, I wasn't sure if it was because it aligns with the accreditation or because it's a very simple process, but there's not a lot to do to maintain status, which is nice. As far as like the nuts and bolts of getting project proposals and attestations and submitting to MOCAM, it's divided between me and we have a coordinator in our department. My role is to try to find what's going on so that we can offer credit for it, and to review initial proposals. And then once that's in place, our coordinator does the MOCAM submissions, and we have a learning management system we use to have people do their attestations. And probably, over the years, maybe because being involved in this quality improvement type area, we've tried to streamline things over the years too, so that now some of the things that seemed, like bulky are now minimal. So we've definitely streamlined a lot of pieces to it. The busy season is at the end of the year for us when there's a lot of projects ending and submissions to do, but it's, that that's going to happen. And so we plan for it to make sure that Michelle, who does the nuts and bolts of it, is like free, the week before the last week in November or whatever it is. So that is the busy time, but I mean, it's all for a good purpose for getting people this credit. So that's our experience.
Thank you.
Sure.
And you both sort of alluded to this a little bit, but just to ask you directly, how much staff time do you think it takes to run the program? And Rose, we were already talking with you, so why don't you go first?
That's a good question. I was trying to do this earlier and I did. I would say for me, it's maybe like, under 10% of my FTE, maybe 5. And then for the coordinator, I would say it's probably like 10 to 15, maybe 10. But really, like, with that focused time at the end of the year, it also kind of depends on the number of projects that we have. Our organization has kind of changed its orientation to many smaller projects happening within departments to like big ones that are done, like for like the whole primary care network, or so which is like a lot of people but less individual projects to submit. So in years past, I would have said it was more, but currently the way that we're doing this and working with the QI department, it's like larger projects, but less of them. So that's how we're using it. And so that's why it's relatively minimal for us. If we were to start supporting many projects again with like smaller groups of people, I think that would up the amount.
Gotcha.
Sure.
Yeah, no, it does. So what I think I heard you say is that it's about 2 of you that are working on this right now, right? And the program manager is doing a little bit more, spending a little bit more of their time than say you are.
Exactly.
Is that right? Okay, got it. Thank you for that. Ronnie, I'm sorry. Same question to you. I forgot I didn't ask you that one yet. How much staff time does it take to run your program after initial setup?
I would say for me, because my time is around less than 5% to run the program. There might be a little bump because we follow more, our busiest time is more the end of the academic year because that's when in July, when June or July, when the residents and the fellows are graduating, we require them to have a complete project. And usually in May, we do have our scholarship week, or instead of research week, now it includes QI. And if they submit their poster to our research scholarship week, we basically, technically it's a completed project. It has a poster. It's been peer reviewed by our faculty because we pick winning abstracts. And then what we've done over time, and that maybe why there's a little bit bump and more busy time during June, July, is we made submitting the MOC application to the portfolio as one of the on their graduation checklist when they're trying to kind of finish and leave. Okay, did you submit your keys? Did you give your badge? Did you submit your MOC? Because we know that those if they're finishing training or if they're continuing into fellowship, we wanted the filling out the application. There's a lot of learning from filling out the application as a project leader. So we allow our trainees to be the project leader and actually to fill it out, and that will allow them to learn a little bit more about the portfolio, so that when they go out to a different institution and they know what that means, and they know that if maybe like I had people join the hospital, and the first thing they asked if we do have a portfolio, maybe because they were in a different institution and that had a portfolio, and it helped them get the credit. So anyway, so So June and July is a little bit more busy for me, and so it'll be more than 5%. But since it's not the end of the submission year for the credit, which normally it is, November, December, I have time, so I kind of stagger them to enter
Oh,
the
sure.
attestation over time, because they're not in a hurry to get them. So but that's really the more busy time. But I would say less than 5% on a regular day-to-day basis because
Okay.
yeah.
Okay. Great. Thank you. Ronnie, to you again, what other departments do you work with to make this program work?
I would say definitely, since obviously you're going to have to work with the different clinical departments because that's where the work is being done. But also, but definitely the main one would be the quality department, because the quality department is they do actually, maybe that's why I am able to do less than 5%, because some portfolios take on also the education piece about QI. This is done by our quality department. They offer green belt and yellow belt for Six Sigma training for people who are really want to deep dive into QI, and all of that. So, but I work with them closely because they know sometimes that which projects are going on. Occasionally, occasionally there might be some duplication in the sense that the medical education team is doing something on the same topic that maybe it's a hospital initiative. And maybe both of them could use the help from each other. They could use the help of the residents and fellows to do the work. Plus also they need to move that project more. And then I usually just get them together and then encourage them to submit for credit, for points. But usually, I would say the main department would be the quality department, and then the
Okay.
second ones would be the ones that have training programs, like the department that we have residency and fellowships in, because of the requirement of QI for training. So
Sure. Okay. Okay. Rose, how about you?
Yeah, very similar. Definitely for us it's the office of the chief medical officer and the clinical departments that are doing projects.
Gotcha. Thank you both for that.
Sure.
Um, okay, let's again kind of shift a little bit and think about, I would like to know from you both, in what ways do you feel supported by the ABMS? And that could be ABMS at large, ABMS portfolio program, ABMS community, whichever way you want to define that. And Rose, I'll ask you to go first, please.
Okay. So I would like to say I feel very supported by Tina and Spencer. They are completely amazing and answer all questions. And if sometimes we have weird situations that I'll be like, how can I get credit for this particular type of thing that's happening? And they'll hop on the phone and think it through. They'll think of other places that are doing something similar. So that, or if we have a question, that responses are really fast. So that is very amazing and helpful. And then the monthly calls that that they have, or now they're kind of more like conversations, have all been so helpful in just learning from different portfolio program sponsors about how they do things, is also really, really helpful. So that is how that's how we've been supported. It's been
Wonderful,
great. Thank
thank you.
you. Sure.
And Ronnie, how about you?
yeah, I definitely, I would say, Tina and Spencer have been very, very helpful in whenever there is, one is definitely simplifying things. I know Rose mentioned about the yearly kind of touch point that we have, and they usually are very kind of making it like it's not onerous. It's just that, it's just a little discussion about, how things are going. So they really try to kind of streamline that. There's a lot of also throughout the year, a lot of kind of webinars similar to this, where education that they provide, and almost like office hours type, where people kind of join and then ask questions, learn from each other, different formats. I think those webinars are very helpful. And then definitely, between Tina and Spencer and the ABMS, the annual conference. I remember the first time, the first year we were a portfolio sponsor. We presented at the ABMS conference that you had at that time in September in Chicago, and so it was cool also to kind of showcase some of our QI projects through the portfolio and through your conference. So that was also very, you feel well supported because you feel there's a community out there of portfolio
Yeah,
sponsors, and then you learn from each other. So that was very helpful.
that's very good to hear. I appreciate that. And for both of you guys, are there I know you just mentioned a few of them, but what ways do you feel that you are engaged with other sponsors in the community? Rose, go ahead.
Yeah, I mean, I do think it's through the connection that ABMS facilitates with the meetings and taking part in other groups where we know other sponsors and talk about quality improvement and how it's being done. So I think it's really through the connections that happen here that have been so helpful.
That makes sense. And Ronnie, are you the same?
Yeah, I definitely, and I think, I know a while back, if I remember correctly, it's very vague, but when we first became sponsor, I had a question, and then I remember getting connected with another sponsor to kind of, which was great because, um, they were similar setup with us, like a children's hospital, and you guys helped connect me to them. And that was great as well because
Good.
it was very useful. So
Good. We do get questions periodically from folks who are interested in the program and are like, can I talk to somebody who's inside the program? So it not only happens internally from one sponsor to another, but it's also happening sometimes from external organizations to a sponsor. And we appreciate all of that. Okay, so let's talk about impact and value. Ronnie, I'll start with you. And there's three parts to this question. What benefits have your clinicians, your program, and your organization experienced through the portfolio program?
yes, so I would say for our clinicians, definitely they felt like it's an easy way for them to earn their MOC for credits or their QI for MOC for maintenance of certification, um, because we're here, like we're on site, we can, and many times, especially for the ones who are, what I noticed, if this is the first time they had to actually do their MOC points, sometimes they're a little lost and they needed to. So I think having the portfolio here and allowing them to kind of, they submit to us, they don't need to kind of try to find different ways and if they want to go outside. So that's definitely added value for them. For the program itself, I would say being part of the portfolio program and again, it helps. I mentioned about U.S. News World Report. It helps. That's for the institution. It's added value for the institution. But also, I think a lot of our we track as a portfolio program. We track also how many credits we gave, how many. So being able to show, I report to the chief clinical officer to show actually the value that this program is providing to the community, or residents, fellows, faculty, to say, here's how many projects we approved, here's how many credits we gave, here's how many people we benefited from the program. I think also we track those. I think MOCAM has really nice reports that you can download and shows you kind of a little bit kind of your activity, I guess, and that helps to show that added value to your institution. And then I guess for the institution, the value, like I said, the U.S. News World Report. I think having one of our requirements for medical staff is they require all the staff members to be board certified. So it's almost like you want them to be board certified, but also you want them to maintain their certification, not just on joining.
Right.
So that's also allows them to actually feel like there is the support even from the administration to the physicians or the practicing clinicians.
That's great. That's great. Thank you, Ronnie. And Rose, same question for you. Benefits that you are aware of to clinicians, your program specifically, and the organization.
Sure. So for the clinicians doing the projects, definitely getting the credit. They really find it valuable. During COVID, one of our doctors did a analysis for their department on the value of the credits that we were able to give through COVID. And I'm sorry, I was looking for the email earlier and I couldn't find it, but it was a high number because their program had however many physicians and the amount of time and the amount, if they weren't to get the credit through that COVID pathway,
Mm-hmm.
what they would have had to do otherwise. So there's that. It's a way for us to formally align the accredited continuing education with QI and offer the credit. So that's a benefit for our program. Also for our program, we recently became reaccredited and we used several of the projects in our self-study. So it's a really transparent way to show impact of activities because you get your before data, you get your after data, you get your interventions. And so if there's, the way I feel about it is that there's really amazing work being done and this just makes it very visible and also easy to report. So it's
Mm-hmm.
really, to me, it's really like a privilege to be part of it. So it's nice. Yeah, so it's just a really nice way for our program to be able to find ways to provide credit for work that's being done. For the institution, Ronnie, I'm glad you mentioned that because I once in a while will get an email, with someone asking about it, and that is why, because they're reporting up to U.S. News and World Report or wherever it is, and I forgot about that. Definitely the I think it's been a benefit for the credentialing office for sure. That like sometimes when things are going very smoothly, it's not as visible because everybody is having their credits and they're not, getting that message that they don't have enough credits or things like that. So it's almost like one of those things where when it's going well, people almost forget about it. But then if it is taken away or it doesn't happen, then it's like, why, what's going on? So it's definitely a benefit when it goes really well. It's almost like an invisible benefit. And then also just the time,
Sure.
because if if people are doing these projects, I think there is a benefit that they're doing more projects because, like, I think from what we were talking about, it just becomes more mainstream or regular for this to happen. But even when that's not the case, when people are doing the projects and they get the credit for the work that they're doing, they don't need to do something like after hours on the weekend when they wish that they could be, right, like they don't
Yeah.
have to do something that's less meaningful. They've already got the credit from something that they did as part of their work. So that's the time and just the, I don't know, the good feelings around that are
Mm-hmm.
really important.
Yeah, some of those intangibles that you can't put a price tag on. Okay, last question, and then we'll open it up for questions from the audience. What would you tell an organization who is thinking about applying to the portfolio program right now? And Rose, we'll start with you.
Okay, sure. I would tell them that it's doable, and that Tina and Spencer are very helpful. And also the few little, maybe tips. Sorry, I'm trying to read my own writing. That if you can find a way to make sure to start to document the value that it's giving, it's very helpful. We've definitely tried to do that in different ways, and also that the make it as easy as you can for people to do their attestations and for you to get the information and submit the credit, because there's going to be attrition. And I know from our experience, like, we'll get asked, like, why aren't 100% of these people who are doing this work getting the credit? But not because of the timing of people's recertifications. Not everybody's going to go through all those steps. So you want to make it as easy as you can and send as many reminders as you can so that people do it, but then also to be able to report on it in a way that is showing that people who are needing the credit are getting it, and that it's not necessarily everybody who does it is gonna. We want everybody to go through those steps every time, but it's also if they don't need the credit this year, they're probably not gonna. They might not click on the link, and that's not a big loss. So I think a way to report on those metrics that's like grounded in the real experience of people that are doing a reaccreditation is really important.
That's really helpful.
So that is my recommendations.
Yes,
and also, if anybody wants templates or anything like that as you get going, we're totally happy to share what we do. You don't have to copy them, but if you want to start with not a blank page.
Thank you. And thank you for offering that. And Ronnie, last question is to you.
Yes, so I would say definitely telling an organization thinking about applying, I would say it's easy. I know Tina and Spencer make it even easier. It's very streamlined. I think it's definitely an added value. It helps you also. One thing I forgot when you asked me about other departments, because I am also the CME department as well, so I did not think about the CME department being another partner. Because one thing to think about for those of you who are separate from the CME, like I am GME and CME, so it's one, but I know in universities, these are like three different departments: medical staff, medical education, and CME. So in the CME world, for institution to get accreditation with commendation, quality improvement is one big part of it. So I think they have a stake in the game as well. And I think getting more faculty to kind of be doing meaningful QI will actually enhance the CME, but also partnering with CME as well, because sometimes you need the education. Some projects rely on, if you create a new pathway for stroke and you need to actually improve outcomes, you need to educate people about the pathway. So you need the CME department to help you with that. So I think partnering with, that's a natural partner. I didn't think about it because I'm the same person here. So
That's great.
but definitely, I would say it's a low lift to get started. I think it's look at things you're probably already doing. I think it's a lot of the stuff that you're already doing you could use for to get started. And again, I will echo what Rose said, that I don't believe in reinventing the wheel. I think if we could always share, and that's how actually when I got started, what made it so much easier is reaching out to places that very similar to us, and they were willing to kind of share their experience as well. And like I said, Tina and Spencer, they always have the answer, and if they don't have the answer, they connect you to somebody who may have the answer.
Can I had one more page. I forgot. I had to flip over my
go
notebook.
by all means.
I also it's not just the projects. There's also these really great templates that you can use for QI leaders and posters. So look, when you start, look at all the options for being able to provide the credit, because there's some super simple ways to get people the credit when it's clear that work has already been done. So just a little, I wanted to mention that also.
Yes, thank you. And on that same note, it's important to know that these things can be documented and submitted after the fact. Not like a CME project, where certain things have to happen before it even starts, or you can't offer credit. It's not like that. After the fact, if you realize one of these activities met requirements, then you can submit it for credit, and the people who participated in it as well.
A good point.
Okay, so with that, we have about 10 minutes left, 9 minutes left. What questions do we have from the group? And you guys can feel free to take yourself off camera and off mute because it's a small enough group that we can manage that. So.
I'm sorry, this is Carrie from the SVS. I missed the FTE requirement, and what is the annual fee?
So there's no FTE requirement, but both Ronnie and Rose reported how much time it was kind of taking them, and one was about 5% of his job, and Rose was about 10% of her job, plus another 10 to 15% with another person. Does that help?
Yes, thank you.
Okay, and then you asked about the fee. There's an application fee of $2,500 to the portfolio program, and most organizations fall into our first tier, which is a $3,500 annual fee, plus some incremental increases based on utilization of the program. Thank you for that question, for those questions. Anyone else?
This is Alyssa from AASM, and I'm still kind of getting caught up on all of this. I would love to see that template, Rose. Could you possibly send it to me?
Oh, yeah, sure. I'll send you our proposal and the project template that we have people submit at the end. And
Awesome.
I think I could probably do it. I'll do a screenshot of like the attestation also.
Oh, yeah, that sounds great. Thank you.
Sure.
And I'm on the invitation, or I can shoot you a quick email. Thank you.
Okay.
And you guys have
you know
just
what?
witnessed how.
I'm just going to do it here. I'll just send it in the I don't know why I didn't even think to do that. Thank you.
Okay.
I was just going to say what you guys are witnessing is how sponsors always interact with one another. And as Ronnie and Rose both alluded to, everybody is willing to share and to talk and to help if you have questions or, want to bounce some ideas off somebody or whatever. So the community is really great that way, and it is not an accident. So it makes me really happy to know that people feel that way.
I did put in the chat the link to our MOC website that has usually there we list the approved projects so that people know what projects are available and who's the project lead, just to kind of showcase that. But also there are one menu on the left that says forms and resources, so it has our downloadable application and the different forms that they could use. So definitely check it out, and I'll be happy to answer any questions from there if you have any or require any additional material. I'll definitely share.
Thank you both for being so willing to share. I appreciate that. Spencer, is there anything you're seeing in the chats? Any questions for folks in the chats or comments?
Yeah, there's a new question in the chat from Anita, and she says, so we are accredited as a sponsor, or are we submitting QI projects for approval?
Neither of those things. You're submitting an application so that we're approving your QI process, essentially. You're going to tell us how you do QI. How is it designed? How is it implemented? How is it monitored rather, and tracked? And you're going to then tell us about that in the application process. Then once you're approved as a sponsor, you are doing the approving on the ground level. You send us the activity information and the information about those who have completed those activities, but that is all happening at the sponsor level. So it's not an accreditation like ACCME. Great question.
And I was going to mention one thing about the, for example, for the annual fee, for example, usually I share that cost with the medical staff office because they also have a stake in the game in keeping the medical staff board certified.
Sure.
So they're actually happy to do that. So I wanted to kind of give people ideas of how they can come up with the other thing to justify it is since we don't do external application from external people, they're all like homegrown projects. So normally if each one of those physicians are going to apply directly to the individual board, some board charge per application. So sometimes having this portfolio with the applying through us and we submit it, it's almost like a money saving technically, depending on if the institution generates a lot of projects. So it's actually will come out pretty close. A lot of boards are very good at if somebody like we've had people in individual faculty may have submitted something to an individual board and the board knows that we are sponsoring a portfolio sponsor, they actually will send them back to me.
Yes.
They would say that, okay, this person is submitting this instead of charging them for it. Like a lot of boards now are waiving the fees, but before it did have a fee before, but at least they keep funneling them through us so that sometimes they might not know that, we are a sponsor. Maybe we don't toot our horn as much as we should. So.
Let us help you with that.
Yeah.
Oh, goodness. Any other questions? I'm not seeing any hands raised and I'm not seeing anything new in the chat. Spencer, did I miss something?
Nope.
Okay. All right. Well, we can go ahead and wrap it up. Ronnie, Rose, thank you so much for being here and for sharing your experiences with everyone today. We really appreciate it. It's a joy to work with both of you. And thank you to all of you who joined the call today. Please reach out if you have any questions to myself, Tina Nelson, or my colleague, Spencer Walter. And you can find us both at abms.org. Thank you so much and have a wonderful rest of the day, everyone. Bye-bye.